For nearly a decade now, Bernie Sanders has galvanized a massive political movement embodied by democratic socialist values and a defining universal health care platform. Now, after dropping out of the presidential race and endorsing Joe Biden, Sanders is back to the Senate full-time, helping to lead the charge to find solutions to the COVID-19 pandemic on both the economic and the health care fronts. I'm happy to welcome Senator Sanders back to the show. Senator, thanks for joining me again. I last talked to you a couple of weeks ago, just before you had decided to suspend your campaign. And at the time, you had told me about a bill that you and several of your Senate colleagues were working on to extend health care coverage to all Americans for all medical care, not just coronavirus-related care. What's the status of that?
Look, the main point here, Ali, is that when 26 million people have lost their jobs, many millions of them are losing their health care as well. This is on top of the 87 million before the pandemic who are either uninsured or underinsured. What we have got to make sure right now during this crisis is that everybody in America goes to the doctor or the hospital when they need to go without worrying about how they're going to pay for that. And that means that we make sure that Medicare covers the uninsured during the crisis, fills the gap for the underinsured, including those people who have private insurance, high deductibles, and high co-payments. Bottom line here is, if you're sick right now, you go to the doctor when you need to, you go to the hospital when you need to, and Medicare will cover all of those bills.
Senator, in an op-ed that you penned in the New York Times, you in part lay out why guaranteed universal health care is needed now more than ever. I'm just going to quote. You say, the absurdity and cruelty of our employer-based private health insurance system should now be apparent to all, as tens of millions of Americans are losing their jobs and incomes as a result of the pandemic, many of them also losing their health insurance. This is what happens when health care is seen as an employee benefit, not a guaranteed right. You and I have had this conversation before. It didn't have to be this way. We are one of the only countries in the world, certainly of the developed countries, in which your ability to be covered for health care, for medical care, is dependent on your employment. It's hard for people to get their head around the fact that it doesn't actually have to be that way, and it isn't for most people.
Please, I hope that the viewers understand, as you've just indicated, we are the only major country on earth not to provide health care to all people as a right, as opposed to an employee benefit. 50 miles away from where I'm talking to you right now, as you well know, is Canada. Somehow or another, in Canada, they managed to provide health care to every man, woman, and child as a right, spending about half as much per capita as we do. And if there's anything that the American people are now learning, is how absurd, how irrational it is to have your health care tied to your job. Because when you lose your job, you lose your health care. That's why we have got to fight, in my view, for a Medicare for all single-payer system. It'll cost the average American substantially less than they are paying today and cover all of us in a comprehensive manner with freedom of choice to the doctor or the hospital you want to go to.
So you and I have talked about this for a long time. As you know, as you've said, I come from Canada. I grew up in a system in which it was a single-payer system, and I've seen it work. And I've seen the nonsense that people talk about it down here about death panels and people dying in the waiting room at hospitals. It's not really true. The lineups of Americans coming to the United States to get health care, it's not true either. But given that you are not the candidate right now, I know you're staying in the race, but given that you're not likely to be the Democratic nominee, and given that Joe Biden hasn't fully endorsed this idea, and given that Donald Trump and Republican senators aren't endorsing the idea, what's your best outcome right now in your mission to try and get people to embrace this?
Well, my best outcome is to go forward in the direction of Medicare for all, but not do it perhaps as quickly as I would want. For example, Ali, in my view, if Joe Biden said tomorrow that every American 55 years of age or older would be eligible for Medicare, I think that would be enormously popular and an enormously effective policy program. Second of all, in a simple way, one of the many problems of our current dysfunctional system is not only its cost, not only the people who don't have health insurance or they're underinsured, it is the incredible complexity of the system. You got to fill out 1 million forms in order to get anything. And at least what we should do is lower the eligibility age for Medicare from 65 to 55 and cover all of the children in this country. And then we can figure out ways that we can expand and improve the ACA. Those are some of the things that Joe Biden can do without embracing a full Medicare for all concept.
Team, subscribe for more of these type of videos.